Hello, I'm Dr. Michael Kohler, and this is Thad, who works for Loyola as one of our standardized patients. The purpose of this training video is to introduce first-year medical students to taking blood pressure and assessing pulse, and also introducing you to the steps of the cardiovascular examination, as well as reviewing some surface anatomy relevant to the cardiovascular examination. And of course, before we begin any exam, we always wash our hands, so I'm first going to wash my hands. Let's first review the 4 factors that influence arterial blood pressure. First, there's left ventricular stroke volume. Second, there's the distensibility of the large vessels and the aorta. Third, there's peripheral vascular resistance. And finally, fourth, blood volume. A change in any one of those 4 factors will influence the arterial blood pressure, whether it's systolic or diastolic. When assessing pulse, we normally use the radial pulse at the level of the wrist. It's superficial to the radial bone and lateral to the flexor tendons, which can be identified if you have the patient flex their wrist. By placing, again, the pads of your fingers just lateral to the flexor tendons, you can palpate the radial pulse. By simply counting the pulse for 15 seconds and multiplying by 4, you get the beats per minute. If you're unable to assess pulse at the radial level, you can also assess the pulse in the antecubital fossa by assessing the brachial artery. If you ask the patient to make a muscle, you can identify the biceps tendon, and then when they relax, just put your fingers, pads, medial to the biceps tendon, and you can identify the brachial artery and take the pulse there. Finally, you can also assess pulse by assessing the carotid artery in the lower third to lower half of the neck by simply placing your finger pads just medial to the sternocleidomastoid muscle. You'll note when you take the pulse, the symmetry of the pulse. When you're assessing radial artery pulse between the right and the left side, there should be a symmetry and you should feel both pulses simultaneously. You'll also, again, note the rate, what's the beats per minute, and you'll note the rhythm. You'll try to determine if the rhythm is regular or if the rhythm is irregular. If the rhythm is irregular, you'll try to determine if there's any pattern to the irregularity. Is it sporadic or is it totally irregular? And by that I mean, is every third beat come early? Is there a pattern? Or is there a pattern that the irregularity varies with respiration? Does the pulse speed up with inspiration and slow down with expiration? Or finally, is there no pattern whatsoever, in which case the pulse would be irregular? And that's always an indication of atrial fibrillation. If the pulse is irregular, you need more than 15 seconds timing to assess the pulse. In fact, if you're not sure, you may need to check the pulse for a full 2 minutes. You, of course, need a sphygmomanometer with a blood pressure cuff. And of course, a blood pressure cuff is not one size fits all. The largest blood pressure cuff is known as a thigh cuff, although this can be used on a patient who has a very large arm. The width of this cuff is approximately 18 centimeters. The next largest cuff is known as a large adult blood pressure cuff, and this one is approximately 15 centimeters wide. Then we have the normal adult blood pressure cuff, and it is about 12 or 13 centimeters wide. And finally, we have the smallest blood pressure cuff, which can be known as a pediatric or small adult cuff, and this one is about 10 centimeters wide. To determine which cuff is appropriate, we need to measure 2 different variables on the arm. We measure the width of the blood pressure cuff against the patient's arm. The width of the blood pressure cuff should be approximately 40% of the circumference of the arm. Also, determining the total length of the bladder of the blood pressure cuff, which is where the tubes come out of the blood pressure cuff. When you wrap the blood pressure cuff around the patient's arm, it should approximately be at least 80% of the circumference of the arm. The length of the bladder does not represent the entire length of the blood pressure cuff. Notice where the tubes come out of the blood pressure cuff, and notice that that area is thicker. This is where the bladder of the blood pressure cuff is, and it's the length of the bladder that we're interested in, that should be 80% of the circumference of the arm to be the correct size. So a normal adult cuff fits that just fine. You go ahead and place the blood pressure cuff snugly on his arm. You'll notice I'm approximately 2.5 centimeters above the antecubital fossa. Bates will recommend that you check the blood pressure with the bell of your stethoscope, but I think you'll find most physicians at Loyola use a diaphragm to measure blood pressure. Again, the blood pressure must be taken on skin. It shouldn't be taken over an article of clothing or the patient's gown. And the patient should be relaxed and calm. Don't check the blood pressure. The patient just rushed into your office, they're late, or if they're crying, because of course the blood pressure will be elevated. First, we're going to check the blood pressure by palpation. Simply identify the radial pulse, tighten up the valve in the blood pressure cuff, and by watching the sphygmomanometer, I'm going to determine when I stop feeling the radial pulse and blow up the cuff approximately 20 beyond that. And I felt the pulse disappear about 110. As I released the air from the cuff, I felt it return about 110. This tells me that the systolic blood pressure is approximately 110. So when I go to auscultate the blood pressure, I know I only